Alright, hi guys, very good evening to all of you, and welcome to our today's YouTube session where we'll be discussing some of the important topics from INI-CET perspective. This will be a 1 hour session in which we'll be discussing what are the different topics that have been asked in the previous examination, and accordingly some of the important questions related to those topics also we'll be doing in this session. So let me start this session very quickly, but before that I need to know if I'm clearly audible and visible to all of you guys. For all the students those who are live, please give me a quick confirmation through a live chat option. Everyone those who are live and want to participate in this chat, there's a live chat option that is going on in which you can participate. So please click on true if I'm clearly audible and visible, and then we can immediately start. Alright, great. Thank you very much. So before I start, a couple of reminders that I'm having for upcoming batches that is being starting, and also the upcoming subscription. If you guys are subscribing to Unacademy, please don't forget to use the code PHARMA10 to avail additional discount. Currently you can avail a discount of up to 20%. This is valid until August 26. Okay, so already there is a 50% off going on, and in addition to that you can earn additional 20% off, and the same code you can use. Very easy to remember, the name of the subject itself, that is Pharma10. In any of these you can use this code to buy an Unacademy subscription. You can also use it to buy an Iconic subscription. Iconic subscription will be everything about Unacademy and Preparator both. This is one of the batch, NEET PG 2023 integrated system wise batch. So like for example, let's say if there's a cardiovascular system, so this will be integrated batch. Usually there will be 2 educator session where 2 important subjects which can be integrated according to the recent NMC guidelines will be taken in this particular batch. So this is going to start on August 25, and all the other students, those who have not participated, please go, please make sure that you are going on the tab and clicking on enroll now. NEET PG 2023, this is the one, system wise batch. It will be a 5-month course that is going to start in the month of August. Then QBank 2.0 is coming soon. You can utilize it for your preparation definitely, where new questions have been added, and most of the question will be clinical based scenario. Plus you can also assess your own performance right away at the end of the test. Alright, so after this short introduction that we have about the new value offerings on the platform, let's get started with what we have actually scheduled this session for. So I'm going to start with one very simple question, and then we can proceed accordingly. You guys can participate in the comment section here once again. Alright, so there was very simple question, and accordingly I will also be discussing what are the upcoming expected question from these particular topics. Inhaled nitric oxide is used in the treatment of, so there is a option like migraine, chronic resistant epilepsy, pulmonary hypertension, arrhythmia. Very easy topic, starting with the easy one. Please go ahead, all the students those who are live. Inhaled nitric oxide, in which scenario we can use? Alright, great. So most of you are giving the correct answer, which is inhaled nitric oxide definitely can be used in pulmonary hypertension. Now the question arises that what are the other drugs that can be used in pulmonary hypertension? You can expect questions from these. And other option like migraine, inhaled nitric oxide or any drug that is going to increase the nitric oxide will be contraindicated in a patient with migraine. Like let's say nitrates are contraindicated in migraine because they can precipitate, they can increase the pain. Nitric oxide is contraindicated in migraine patients. Then my next question to all of you guys, that what are the other drugs that are used? So quickly we can just go through about other drugs. First and foremost thing is the drug of choice. We are going to have endothelin receptor antagonist. Endothelin receptor antagonist like your ambrisentan, sitaxanthan. Expect this question. Then we are going to have bosentan. Now why am I writing in 2 ways? I mean 2 different sections, macitentan, because one is selective, other one is non-selective. Ambrisentan, Sitaxanthan, they are the specific endothelin A antagonist. Bosentan, Macitentan, they are the endothelin A plus B antagonist. So these are actually the drug of choice, especially in grade 2 and grade 3 pulmonary artery hypertension. Other drugs that can be used will be PGI2 analog. What are the PGI2 analog that we can use? We can use drugs like your epoprostenol, treprostinil, and iloprost. A new drug that we are having on PGI2 receptor agonist will be Selexipag. Again, very simple drug, prostacyclin agonist. All other agents, they are also having prostacyclin, treprostinil, iloprost. So PGI2 analog, prostacyclin analog, it's one of the drugs that can also be utilized, and especially these are highly effective drug and they are considered as a drug of choice in a patient with the grade 4 pulmonary artery hypertension. Grade 4 pulmonary artery hypertension, they are the drug of choice. They are very expensive, and if you are going to compare the efficacy of endothelin compared to prostacyclins are having better efficacy compared to endothelin receptor antagonists. What are the other drugs that we can use apart from these? Apart from this, we can also use soluble guanylyl cyclase activator. Very simple drug, Riosi-Guad, which itself is selling guanylyl cyclase activator. Then we are also having, we can use CCBs, amlodipine, nifedipine वगैरह. We can use this as well. Phosphodiesterase 5 inhibitor, sildenafil, tadalafil. In fact, sildenafil specifically was approved for this purpose only. Later on, it was found out that it is highly effective also in erectile dysfunction, and now in erectile dysfunction it's the drug of choice. Here it's an add-on drug, especially we use it in fixed dose combination with the endothelin receptor antagonist. Alright, then inhaled nitric oxide, of course, as I have asked here in this one. And this is one of the PYQ question that has been asked in one of the INI-CET. Alright, so I hope all of you guys can get a question like this. If examiner is going to ask you on pulmonary artery hypertension, expect the question on this, especially a case-based scenario. A patient is coming and he's having difficulty walking a couple of let's say a flight of stairs, and also they can give you, let's say, a chest x-ray that is going to have bat wing appearance and all the other clinical clinical finding they can give, and they can ask you which of the following drug you can use. Alright, so we'll take the next one. Programmed death cell receptor 1 antagonist is also one of the topic which is being discussed nowadays a lot, and recently we have seen this question was asked even in 2022 INI-CET, 2022 NEET PG, in both the examination. So expect this question, because in 2018 the scientists, those who were working behind this pathway, they were given Nobel Prize. Okay, so nivolumab is a monoclonal antibody which targets a programmed death cell 1 receptor or a PD-1 receptor antagonist. It is used in the management of which of the following? Go ahead please. Let's see how many of you can get this. All the students, those who are live, go ahead. Retinoblastoma, medulloblastoma, Hodgkin's lymphoma, pleuropulmonary blastoma. Anil Kumar is in favor of 2. Shiva is in favor of A, I guess, and he deleted. Shushma is in favor of D. Other students also, please take part. Don't be shy to make mistake here. Very good evening, Dr. Raman. Sunny is also in favor of B, medulloblastoma. Okay. Now, first and foremost thing, what are the programmed death cell receptor 1 antagonists, PD-1 antagonist? These are drugs like pembrolizumab, atezolizumab, nivolumab, cemiplimab. These are the programmed death cell receptor antagonists, and I always call them PAN card, right? Because in 2022 they asked you to identify which is a programmed death cell receptor antagonist, right? PAN card, Cemiplimab is specifically used for squamous cell carcinoma of the skin and squamous cell carcinoma of the lung. These above three drugs pan that we are having, they are mainly utilized. Their uses that we have are used in a patient with the Lynch syndrome. We can use them in a patient with the Lynch syndrome. We can also use them in a urothelial carcinoma. Lynch syndrome patient mainly presents with a colorectal carcinoma. So Lynch syndrome or colorectal carcinoma in Lynch syndrome. So word will be same. Non-small cell lung cancer. We can use them in non-small cell lung cancer, colorectal carcinoma, and also we can use them in a Hodgkin's lymphoma. So two things which I always discuss in the regular classes as well, and even in the special free classes as well, that PAN card and the uses of especially PAN card, I used to say lunch. At least lunch yaad kar lo. Lynch syndrome associated with the colorectal carcinoma, urothelial carcinoma, non-small cell lung cancer, colorectal carcinoma, and Hodgkin's lymphoma. So this was the question that was asked, that which of the following is one of the uses of nivolumab. So that is going to be your Hodgkin's lymphoma, right? So correct answer that we are having for this question is going to be option number C, Hodgkin's lymphoma, not the other options like retinomedulo or pleuropulmonary blastoma, right? Then in 2022, there was one question about advanced endometrial carcinoma. Advanced endometrial carcinoma, this is one of the one that is in 2022 में FDA has approved to be used this in advanced endometrial carcinoma, और 2022 INI-CET में ये पूछ भी लिया गया. It was asked in INI-CET 2022 and in 2022 only, this is true actually, it got approval from FDA to be used in advanced endometrial carcinoma. Okay. Alright, a patient on reticabine therapy for focal seizures was added with phenytoin. Next step in the management is, I'm sure all of you guys are aware about which class of drug is reticabine or ezogabine. They both are having similar mechanism of action. They both are actually potassium channel opener. A patient on reticabine or ezogabine therapy for focal seizure was added with phenytoin. Next step in the management is, go ahead please. Very easy one. What will you do as the next step of management? Decrease the dose of reticabine, increase the dose of reticabine, stop reticabine, change reticabine to carbamazepine. There should be a reason also behind your answer. Important points I have underlined already. Go ahead please, Dr. Raman. Dr. Bhuvan is in favor of A, decrease the dose. Dr. Pradeep is in favor of B, increase the dose. Sushma is also telling B. Fatty Doc 23 is in favor of A. Okay, Bindu is in favor of B. Other students also please take part. Good. So most of you are in favor of A, either A or B. Nobody is going towards stopping reticabine. Usually, first thing I'll tell you, I was expecting this question, ezogabine, reticabine. And if you have attended 2019 or 2020 ka batch session, then we have discussed also, it is actually a third line drug in a patient with the management of the partial seizure or the focal seizure. Usually it's acting by a potassium channel opener, therefore they will be causing potassium efflux leading to hyperpolarization of the neuron. We are not using it because they are usually associated with your retinal pigmentation. They are associated with your retinal pigmentation, they causes your bluish retinal pigmentation. They causes actually bluish retinal pigmentation, that is why they are, and also they can cause your skin pigmentation, not only retina but also skin pigmentation, eye pigmentation, इनका भी pigmentation ये कराते हैं. ठीक है. Now whenever we are going to add any drug with the phenytoin, we remember this is actually a general pharma question. Phenytoin is a very potent enzyme inducer. Okay, phenytoin that we are having, it's a very very potent enzyme inducer. This is a very potent enzyme inducer. And we all know whenever we give enzyme inducer, they are going to increase the metabolism. Ultimately, they will be causing treatment failure. If the person is already on reticabine, there are high chances the metabolism of the reticabine will increase and the overall treatment failure risk will increase. Whenever any enzyme inducer is added, one step that you can take is you can increase the dose of reticabine rather than stopping or decreasing the dose. Decreasing the dose can be done with enzyme inhibitors. With enzyme inhibitor, you can actually decrease the dose. Remember, phenytoin is an enzyme inducer. So this is a very, very simple concept here. Okay? Increase the dose. We'll take the next one. In a drug following first order kinetic, what will happen if the dose is doubled? Another general pharma. That's why I give always much importance to general pharma and ANS. We always expect from these two chapters at least 3 marks. General pharma ANS 3 marks कहीं नहीं जाते. General pharma देखिए equation ही आ गई. Then other one. Go ahead please. In a drug following first order kinetics, what will happen if the dose is doubled? Plasma concentration, elimination, half-life is constant. Half-life same, plasma concentration doubled. Half-life is doubled, plasma concentration remains same. Elimination, half-life and plasma concentration both doubled. Try to answer this question, guys. Let's see what you guys have to say about this question. Dr. Uma Raman and all the other students, try answering this question. C, half-life is doubled, plasma concentration remains same. Dr. Om is in favor of B, half-life remains same, plasma concentration doubled. Okay. Bindu is also in favor of B. Alright. Other students also please take part. Most of you going in favor of B for Bombay. Okay. So let us see. Whenever we talk about a drug that is following first order kinetics, always remember the fraction of elimination is going to be constant. Fraction of elimination is going to be constant. Okay. So for example, if you are going to take a 100 milligram drug, after one half-life it will become half. Okay. When you increase the plasma concentration, when you double the dose, let's say 100 ko, if you are going to make it, let us say 200, so of course plasma concentration will be doubled. Either zero order or first order. If you are going to double the dose, definitely plasma concentration will be doubled. There is no doubt about this. So first of all, you look for an option where it is saying plasma concentration doubled. Plasma concentration doubled has been given in option number B and option number D. Either zero order, first order. If you are going to double the dose, plasma concentration will double out. Now if it is following first order, if it is going to be 200, then again it will be taking a single half-life to bring it to half, because the fraction of elimination is constant. And if you are taking the example of, let us say 50% here, then 100 will become 50 in half, in one half-life. 200 will become again, in the very first half-life it will again become 100. Even if you are going to make it 400, again 400 will become 100 in the very first half-life. So plasma concentration is going to be doubled. But is there any effect on the T half-life? No. T half-life, no matter what is the plasma concentration, it is going to be same. So half-life remains the same and plasma concentration doubled. Now why not option D, and what happens in zero order? Let us see. Let us say a drug that is following zero order kinetics, and we are taking as an example, I am taking 25 milligram per hour. And if I am going to start with 100, let's say, then after 1 hour it will become 75. It will keep on happening like 50, 25, and after some time it will become 0. So 100 को 50 में आने में, for you to bring 100 to 50, you are taking around 2 hours because it is 25 milligram per hour. So what is the T half-life here? The T half-life is going to be 2 hours. Okay. Now if you are going to double the dose of 100, okay, it will become 200. So even if it is following zero order, the plasma concentration will double out. But now this 200 will become again 175, 150, 125 and 100. Now 1, 2, 3 and 4. It is going to take 4 hours to bring 200 to 100. It is going to take how many hours? 4 hours. So what will be the T half-life in this scenario? The T half-life is going to be 4 hours. You can keep on calculating like this. For 200 you can make it 400, and in that case scenario T half-life will become 8 hours. But no matter what happens in the first order, if you make it like let's say 800, again in the very first half-life it will become half. Okay, because it is following fixed fraction. Here in zero order, amount of elimination is constant. Amount of elimination is going to be constant. This we always discuss. Simple question, yet option have been created to just confuse you guys. But it was not a difficult question at all. Okay, so half-life remains same. Yes, in the first order half-life will remain same, but the plasma concentration is doubled. I hope all of you guys have got this. Okay, yes, thank you Dr. Bhuvan and all the other students. We'll take the next one. Topiramate is used in the treatment of. Let's see how many of you can mark this one. Topiramate. मैं क्लास में बोलता हूँ एक वर्ड, ये टोपी पहनता है और टोपी पहन के ये 5 अच्छे काम करता है. It has multiple good roles, but 5 important things that I used to give you in the class. ये टोपी पहन के सारे अच्छे काम करता है. क्या अच्छे काम करता है बताइए? In the treatment of migraine, heat prophylaxis, ADHD, Lennox-Gastaut syndrome. If any one of you have attended the anti-epileptic class, definitely all of you can mark this. Okay, good. First of all, let me just tell you that Topiramate is a drug. ये टोपी पहनता है, it wears टोपी and does all the good work. No what are the good work? It is used in the management of the epilepsy. In different epilepsy we can use like generalized tonic-clonic seizure. It can be used in partial seizure, and it can also be used in Lennox-Gastaut syndrome. It can also be used in other condition, like for example ये टोपी पहनता है और ये हेडेक को भी कंट्रोल में रखता है. इट इज यूज फॉर द प्रोफाइलैक्सिस ऑफ द माइग्रेन. टोपिरामेट टोपी पहनता है, इट ऑल्सो कॉजेज वेट लॉस, देयरफॉर इट इज वन ऑफ द एंटी ओबेसिटी ड्रग. तो ये वेट को भी इट विल कंट्रोल योर वेट एज वेल. टोपिरामेट इट वेयर्स टोपी एंड ऑल्सो डिक्रीजेज द एल्कोहल क्रेविंग. दैट्स ऑल्सो गुड थिंग, अ गुड वर्क. टोपिरामेट wears topi and also being utilized in the management of the bipolar disorder, especially in the manic phase of the bipolar disorder. Now for many of you have marked here treatment of migraine. Now this was one of the controversies that was created at that time also, in 19 also. Now also I am telling you, Topiramate is used in the treatment of. First of all, there is a difference here. हम बात कर रहे हैं treatment of migraine की option में, but I have written here prophylaxis of the migraine. That is where examiner have tried to confuse you. Okay? So mainly, according to the study that I have done, according to the research that I have done, the answer for this question should be Lennox-Gastaut syndrome, not the treatment of migraine. In fact, it is used for the prophylaxis of the migraine. For the treatment of migraine, we have drugs like NSAIDs. We can use our drugs like, let's say, triptans, 5-HT1B/D agonist, 5-HT1F agonist like Lesmiditan. Lesmiditan is a newer one that can also be used. ठीक है, तो ये सारे ड्रग्स हैं जो कि यूज कर सकते हैं हम लोग ट्रीटमेंट में, बट नॉट फॉर द प्रोफाइलैक्सिस. फॉर द लेनॉक्स-गास्टाउट सिंड्रोम, मैं इसके लिए भी आपको स्टोरी सुनाया हूँगा. लेनॉक्स-गास्टाउट सिंड्रोम इज मेनली कैरेक्टराइज्ड बाय रिकरेंट एपिलेप्टिक एपिसोड्स, एंड द ड्रग ऑफ चॉइस फॉर दिस कंडीशन इज गोइंग टू बी valproate. It is usually well controlled on the valproate. Other drugs that can be used for this one is Topiramate. Other drugs that is highly effective is Zonisamide, Felbamate, ठीक है, Rufinamide. These are the drugs that are shown to be highly effective in a patient with the Lennox-Gastaut syndrome according to Goodman-Gilman and also Katzen. ठीक है, तो ये ड्रग्स हैं. Other drugs are also effective, but these are very highly effective and they are showing good result in Lennox-Gastaut syndrome. So what I used to say in the class also, that Lennox-Gastaut syndrome, which is characterized by recurrent epileptic episode, it will go and it will talk to valproate. It will deal with the valproate. Please continue in my life. बिकॉज तू जो फिर रुका मैं नहीं रुकूंगा. I'll come back again. It will talk in Hindi actually. For anyone who could not understand, sorry about that. It's actually telling in Hindi, valproate, तू जो फिर रुका. Topiramate, zonisamide, felbamate, rufinamide, तू जो फिर रुका. I will not stop. I'll come back again. If you stop, I'll come back again. It's a recurrent epileptic episode. If valproate will stop, the epilepsy will come again, or epilepsy will be, right? It will recur. So valproate, तू जो फिर रुका मैं नहीं रुकूंगा. ठीक है, सिंपल सा ये निमोनिक है जो आपको हेल्प करेगा. द ड्रग्स दैट आर यूज्ड इन द लेनॉक्स गस्टॉट सिंड्रोम. ठीक है, इसके पहले में इसके बाद 19 के बाद अगेन एम्स ने एक और क्वेश्चन पूछा. क्या? What are the drugs that can be used in absence seizure? I have that question as well that I'll be discussing with all of you guys. But I hope all of you guys have got this. Topiramate, Topi पहन के all good works. And Lennox-Gastaut syndrome में what all drugs that we are going to use? Valproate, तू जो फिर रुका मैं नहीं रुकूंगा. ठीक है, as simple. Okay, which of the following is not an off-label use of risperidone? Again, this was a tricky one. I believe most of the students have marked migraine, and because topiramate पे अक्सर हम पढ़ते हैं migraine, but there was a difference between acute, treatment and prophylaxis. Again, this was also I found little tricky, but when we dig down a little deeper, we found out that there is two words here. One is off-label use, and other one is the FDA approved use. FDA approved use. Off-label use मतलब FDA has not given permission for that, but still it is being used due to its better result. So first I would like to hear from my students, and then I will give you the answer. Go ahead please. Start giving your answer for all the students, those who are live. What are the FDA approved uses? Another one is the off label. तो अब ये बोला which of the following is not an off label use of risperidone? That means which is an FDA approved use? Question simply is asking which of the following is a FDA approved use of risperidone. मैं इसको बोलता हूँ ये बहुत रिस्की ड्रग है. With most of the drug, we have a story to remember about. Risperidone, it's very risky drug. And why do I say it's a risky drug? Because it's mainly one of the highly and it's not working. Okay, risperidone is a risky drug. It's a most potent एटिपिकल एंटीसाइकोटिक्स, इसलिए ये रिस्की है. मोस्ट पोटेंट एटिपिकल एंटीसाइकोटिक्स, एंड इट इज बीइंग अ एटिपिकल एंटीसाइकोटिक्स, इट इज एसोसिएटेड, और आई वुड से मैक्सिमली एसोसिएटेड विद among atypical maximally associated with extrapyramidal symptom and hyperprolactinemia, not others. Other atypicals are usually devoid of this kind of side effect, but these risperidone, it's a risky drug, इसलिए बोलता हूँ ये रिस्की है. ठीक है, तो which of the following is an FDA approved or not an off label use? Go ahead please, all of you are marking either A or B. Okay, so first of all I'll talk about what are the FDA approved uses of risperidone. Risperidone of course is an atypical antipsychotics, so it is utilized in schizophrenia. Other FDA approved uses that we are having is a bipolar disorder. These are the only FDA approved uses: schizophrenia, bipolar disorder, autistic spectrum disorders. These are the only 3 FDA approved uses. अब आता हूं मैं क्वेश्चन पे. I'll go back to the off label as well. Which of the following is FDA approved use? First of all, our answer will be bipolar disorders, not OCD, dementia or PTSD. Do remember this? It was again a tricky question. Not many students could do this correctly, but तुक्का जिसका लगा उसका सही भी हुआ. These are the all off label uses. ये सारे के सारे off label uses हैं. Like anxiety, this table has been taken from a study. Anxiety, attention deficit hyperactivity disorder, dementia, depression, adjunct treatment, eating disorders, there is no trial done but still having good result, insomnia, OCD, हमारे ऑप्शन में OCD भी था, personality disorder, PTSD, we had PTSD as well, substance abuse like alcohol, cocaine, and also in the Tourette syndrome. Another question that we are expecting this time, that examiner may ask, what is the drug of choice for Tourette syndrome? So one of the atypical antipsychotics for Tourette syndrome that we have is aripiprazole. Aripiprazole is the drug of choice in Tourette syndrome. So what are the off-label? These are the off-label uses: Tourette syndrome, PTSD, personality disorder, obsessive compulsive disorder, insomnia, anxiety, dementia, depression, all of them. So if you see OCD, dementia, PTSD, these are all the off-label uses. Which of the following is not an off-label? That is going to be your bipolar disorders. I hope it is the explanation has given you some insight about this kind of question. So this is something very new, and it was meant to check or filter out the cream compared to the rest of the students. Okay. Drug that promote bone formation among the following. Which of the following drug can cause bone formation? Bisphosphonate, raloxifene, calcitonin, teriparatide. From last 2-3 examination we are seeing there is one question that is being asked from the topic of osteoporosis. Okay. So on the basis of side effect we are expecting a question this time. So make sure that you are reading the side effect of bisphosphonate, and also you are going to read the side effect of rank ligand inhibitor. Okay. All of you please try this answer. And I have received most of the answer. It's D. Other students also please take part. Drug that promote bone formation among the following is bisphosphonate, raloxifene, calcitonin, teriparatide. Now the drug that is specifically going to cause or start the bone formation among the given option that we are having, guys, is teriparatide. Other option that we also have in the same is abaloparatide. Teriparatide and abaloparatide. Okay. What are these teriparatide, abaloparatide? These are actually recombinant parathyroid hormone analog. Recombinant parathyroid hormone analog that is going to actually activate your osteoclast, and whenever there is a slight increase in the clastic activity, there will be drastic increase in the blastic activity. So this recombinant parathyroid hormone analog, it is given in the low dose, and they will be increasing the osteoblastic activity. They are going to increase the osteoblastic activity. So mainly these are the ones that are having bone forming property. Can I use bisphosphonate in osteoporosis? Of course, why not? In fact, these are the drug of choice in osteoporosis. Even in the post-menopausal women as well, these are the drug of choice in every age group. These are the drug of choice for osteoporosis. Okay? What is the mechanism of action? Bisphosphonate. Bisphosphonate. What is the mechanism of action? Can any one of you tell me? What is the mechanism of action of bisphosphonates? Like etidronate, risedronate, zolendronate. ड्रोनेट वर्ड आएगा. Go ahead, please. What is the mechanism of action of this dronate? I mean, bisphosphonates. Yes, it is actually going to act by inhibiting osteoclast. It is an osteoclast inhibitor. It will actually deposit in the bone. For example, if this is the bone and here is your osteoclast that is trying to do the bone resorption, these agents are going to deposit in the bone, and along with the calcium, they will also be uptaken inside the osteoclast. And once they reach into the osteoclast, they will start inhibiting, or they will start promoting their apoptosis. So osteoclast will take this thinking that, okay, this is my hamburger, let me eat it out. But once they go inside, the osteoclast realize, no, this is not the hamburger that I wanted. This is not the hamburger that I wanted. This is the poison, and this poison will eat out this osteoclast. So it will start promoting their apoptosis. So in a simple term, they will inhibit the osteoclast. What is raloxifene? It's a drug which is selective estrogen receptor modulator. Selective estrogen receptor modulator. Definitely, they do have some increased activity on the osteoblast, but mainly they are SERMs that are going to have agonistic activity over the bone formation को ये भी बढ़ाते हैं. But if you have to choose between teriparatide and raloxifene, I'll go ahead with the teriparatide. ठीक है. Calcitonin likewise also it will inhibit the resorption. ठीक है. Alright. Then there was another question on antidote. Which of the following drug and antidote combination is correct? So in the examination it was given like this. Option A, 1 के सामने C दे दिया, 2 के सामने D दे दिया, ऐसे करके they have framed. But here I want you to just choose. For 1 A B C D में select करिए. For 2 again A B C D. For 3 also you can choose again from A B C D. 4 also you can choose from A B C D. Go ahead please. Match the following drug and antidote combination. All the students, those who are live, start. Question number 1, heparin. I think it's the most easiest question right now, ever since that I have started the discussion. Okay, एथिलीन ग्लाइकोल और यूपीएससी में एक एग्जाम में क्वेश्चन पूछा, उसमें कार कूलेंट ऑप्शन दिया हुआ था, है ना. कार कूलेंट, अ पेशेंट प्रेजेंटेड after drinking coolant of a car, what is the antidote that you will use? So ethylene glycol is also utilized in the car coolant. 1 for B. Okay, so first of all of you are writing this one. 1 heparin का antidote क्या होगा? That is B, protamine sulfate. And protamine sulfate, it is one of the chemical antagonists for heparin. It's a very good example of chemical antagonist. So when you revise general pharma, make sure you are reading different types of antagonists like pharmacological antagonists, physiological antagonists, pharmacokinetic antagonists, and chemical antagonists. All the chelators are chemical antagonists. Ethylene glycol, I think rightly most of you are marking correct. 2 ka C, definitely that's correct. Actually, fomepizole is the antidote of choice, even for methanol as well. So it's also the antidote of choice for methanol poisoning. Antidote also for your methanol poisoning. देशी शराब जिसको बोलते हैं, देसी शराब. ठीक है. और बताइए 4 का ए, वैल्प्रोवेट का लीवोकार्निटीन, दैट इज एब्सोल्युटली करेक्ट. एंड वी आर लेफ्ट विथ हाइड्रोफ्लोरिक एसिड. ओके, सो ओके, 1 स्टूडेंट. ओके, 1 बी, एथिलीन ग्लाइकोल का सी. 3 ए, हाइड्रोफ्लोरिक एसिड, लीवोकार्निटीन. Who is this? Shekhar Karthik. Other students, okay, now we are having tie between this. Haider Khan is saying 3 ka A, hydrofluoric acid, levocarnitin, and valproate ka. Okay, other students can give me your views for question number 3. Let's talk about question number 3. Rahul Sharma is in favor of 3 ka D, calcium gluconate. Okay. Sushma is also in favor of 3 का D. ठीक है. सो वैल्प्रोवेट का एंटीडोट गाइस लीवोकार्निटीन होता है. दिस इज गोइंग टू बी ए एंड 3 का होगा डी. ठीक है. सो मैच द एंटीडोट इन हेमाटोलॉजी. इफ यू गाइस हैव अटेंडेड एनी ऑफ द हेमाटोलॉजी सेशन, then I used to give you the different antidotes. 5 antidotes I used to discuss in hematology. What are those 5 antidotes that I discussed? एक तो heparin हो गया. Then others I discuss is warfarin. If there is a warfarin overdose, then I used to give you vitamin K1, phytonadione. Or if there is a bleeding, we can even use fresh frozen plasma. Then I also used to give you 10A inhibitor का अगर overdose हो जाए, like for example apixaban, edoxaban, 10A पे बैन लगाने वाले ड्रग, then we can use the agent by the name of andexanet alpha. Now 2 years consecutively this question has been asked even on the andexanet alpha. Immediately after this, after 19 in 20 as well, there was a similar kind of question where option had andexanet alpha as well. So you had to choose the antidote. So 10A का antidote. Streptokinase का antidote has also been asked in 2019. एम्स में पूछा हुआ है 2019 जून वाले में. एप्सिलॉन अमाइनो कैप्रोइक एसिड. ठीक है. इदारुसिजुमैब इज द एंटीडोट फॉर डेबिगेट्रान. Dabigatran is oral 2A inhibitor. It's oral 2A inhibitor. एंड इसका एंटीडोट होता है इदारुसीजुमाब. ये 5 एंटीडोट्स हेमाटोलॉजी में मैं आपको बताता हूँ. ठीक है. अदर एंटीडोट्स वी आर ऑल्सो हैविंग, एंड इन फैक्ट ऑन द बेसिस ऑफ एंटीडोट 2022 का जो एग्जाम हुआ था नीट पीजी, 4 क्वेश्चंस वर आस्क्ड ऑन द बेसिस ऑफ एंटीडोट्स, इंक्लूडिंग ओपियोइड्स का एंटीडोट भी पूछा. ठीक है. एंड अदर्स लाइक ट्राइसाइक्लिक एंटीडिप्रेसेंट्स, उसका भी पूछा. हाउ विल यू मैनेज इफ देयर इज अ ट्राइसाइक्लिक एंटीडिप्रेसेंट. Benzodiazepines, flumazenil is also a very good example. Valproate, levocarnitine, I think I mentioned already. Beta blocker, glucagon, calcium channel blocker. We can use glucagon. Other agents can also be used. Carbon monoxide में we can use oxygen. Cyanide poisoning में amyl nitrite. ठीक है. Lead में EDTA. And this was also asked in 2022. ये भी 2022 में था. ये भी 2022 में था. नीट पीजी में. डिजिटालिस टॉक्सिसिटी में we'll be using fab fragments. In the digitalis toxicity we are using fab fragment. पैरासिटामोल वाला भी आया था where PCM के लिए. सॉरी, N-acetylcysteine. N-acetylcysteine is the antidote for that. ठीक है. Alright, then there was question also on absence seizure. This is the question that I was talking about a while ago. Which of the following drugs are used for the absence seizure? So we have multiple drugs: carbamazepine, valproate, ethosuximide, gabapentin. So which of the following can be used for absence seizure? 1, 2 and 3. 2 and 3 only, 2 only, 4 only. Go ahead please. Which drug is used for the absence seizure? 1, 2, 3 only, 2 and 3 only, 2 only, 4 only. So let me just quickly talk about this. 2 questions that are very commonly asked in absence seizure. One, what is used? Other one, what is not used? So earlier they used to ask multiple times, what is not used? All of the following are used except which of the following is contraindicated. So first let me tell you what is used. I used to say that getting absent from the class to study. So clonazepam is one of the benzodiazepine that can be used. So getting absent from the start, that sir I'll be absent from the class because I want to study, but you never study. क्या करते हैं? वेल्ला घूमते हैं. वेल्ला घूमते हैं, just roaming around without any work. So that is valproate, ethosuximide, and lamotrigine. So these are the drugs that can be effective. So remember I told you a story for our Lennox-Gastaut syndrome as well. That valproate 2 फिर रुका, मैं नहीं रुकूंगा. Likewise, getting absent from the class, absence seizure. Clonazepam is one of the benzodiazepines, and valproate, ethosuximide, lamotrigine, ethosuximide being the drug of choice. These are the drugs that can be used. Then next that you should know what are the drugs contraindicated. Given the option that I have given, the information that I have given you, remember we can use valproate, we can use ethosuximide. So 2 and 3 only. If there is a atypical cases of the absence seizure, atypical cases usually presenting with the motor involvement. Absence seizure में usually motor involvement नहीं होता है. ठीक है. If there is a motor involvement, we can use valproate as well. What are the drugs that are contraindicated? I used to give you the hint or the mnemonic: COPS या COP at TVS. COP at TVS. So carbamazepine, oxcarbazepine, phenytoin, not given. Tiagabine, vigabatrin, or any of the other GABAergic drugs, SV2A inhibitor like levetiracetam, brivaracetam, these are the SV2A inhibitor, they are not given. So I used to tell that COP at the TVS is a very simple mnemonic to remember the important drugs that are contraindicated in absence seizure. ठीक है. तो diagnosis के लिए child presenting with a poor scholastic performance, ब्लैंक स्टेयर का हिस्ट्री होगा. EEG फाइंडिंग 3 हर्ट्ज पर सेकेंड स्पाइक एंड वेव पैटर्न. व्हाट इज द डायग्नोसिस और विच ऑफ द फॉलोइंग ड्रग कैन बी यूज्ड और विच ऑफ द फॉलोइंग ड्रग इज नॉट यूज्ड, ऐसे करके केस देगा. ठीक है. अ वेरी सिंपल, very unlikely to be asked in AIMS but has been asked. 15-year-old female complains of cough, sore throat. She was prescribed an antibiotics. ध्यान से देखिएगा. Following which she came back with the following symptom. After antibiotic, she is having the following. So you can see rashes, erythematous rashes is visible here. Which drug would have caused it? Fexofenadine, salbutamol, amoxicillin, corticosteroid. So any student, even from the second year, first year, those who have attended any pharmacology classes, they can easily mark this even without a second thought. Examiner is telling after antibiotic this problem is coming. Among the given choices, there is only one antibiotics. There is only one antibiotic among the given choices, that is amoxicillin. So penicillin induced hypersensitivity reaction. This is an example of type 1 hypersensitivity reaction, and in the type of ADR it is an example again for type B ADR. B for bizarre kind of ADR. B for bizarre kind of ADR. Okay. Steroids are of course not antibiotics. Salbutamol is a beta 2 agonist. Fexofenadine, terfenadine. ठीक है. Monter FX fexofenadine जो होता है ये, this is going to be one of the antihistaminics. ठीक है. Second generation, ठीक, antihistamine. So the only one that we are having here is amoxicillin among the antibiotics. ठीक है. And previous to this, they gave a case. A patient was given a penicillin. Now he is having difficulty in breathing, fall in the blood pressure. Which of the following drug you will be using and in what concentration? So option में था 1:1000 IM, 1:10,000 IV, है ना, ऐसे करके ऑप्शन दे दिया था. ठीक है. So the drug of choice for this scenario is going to be, I mean hypersensitivity reaction अगर हो रहा है, penicillin induced hypersensitivity reaction और anaphylactic shock. इसको हम ये भी बोल सकते हैं anaphylactic shock. Anaphylactic shock में mainly I am talking about this anaphylactic shock. इसका drug of choice Adrenaline we can use in anaphylactic shock. 1:1000 intramuscular route से 0.5 ml will be injected. ठीक है. 1:1000. To avoid this kind of problem like the one that has been given penicillin induced ADRs, we can actually give the penicillin after a test dose. So it's always advised to give the penicillin after the test dose. Drugs causing sexual side effect. This is also a very common topic that is being repeatedly asked. Like this one. Drugs causing least sexual side effects. So we all know that certain drugs are having multiple sexual side effects, like some of them are causing, let's say, anorgasmia, decrease in the libido, impotency. So drug causing least sexual side effect among the given choices: fluoxetine, venlafaxine, mirtazapine, imipramine. Go ahead please. Start answering this one. Least sexual side effect. Start answering this question please. Is it going to be fluoxetine, venlafaxine, mirtazapine, imipramine? Love Patel is in favor of B. Haidar Khan is in favor of C, mirtazapine. Other students also please take part. Whatever you think is correct, there is no judging here. All answers are welcome. Sahil is in favor of C, mirtazapine. Shekhar also C. Okay. Good. So first of all, sexual side effect is mainly among antidepressants. It's mainly associated with reuptake inhibitors. Which reuptake inhibitor? Mainly serotonin reuptake inhibitors. So if we are going to look at the reuptake inhibitor, we have selective reuptake inhibitor, and we have also non-selective reuptake inhibitors. Under selective, we have drugs like your SSRIs. We have SSRIs. Selective serotonin reuptake inhibitor. Drugs like citalopram, escitalopram, fluoxetine, fluoxamine, paroxetine, sertraline, शेफ ड्रग जो इनको बोलते हैं शेफ ड्रग. सो दे कैन कॉज सेक्सुअल साइड इफेक्ट और इनका सबसे ज्यादा रिस्क होता है. SSRIs का रिस्क ज्यादा होता है. स्पेशली व्हाट काइंड ऑफ सेक्सुअल साइड इफेक्ट दैट दे कॉजेस? They cause one side effect known as delayed ejaculation. Because of this delayed ejaculation as a side effect, FDA has now approved this SSRI to be used in premature ejaculation. ठीक है. Other side effect, it also causes anorgasmia, decreased in the libido. So sexual related side effect can be caused by them. ठीक है. Non-selective में we have SNRI, serotonin noradrenergic reuptake inhibitor. So we have like venlafaxine, desvenlafaxine, duloxetine, and milnacipran, levomilnacipran. So venlafaxine is one of the SNRI. They can also cause. Under non-selective, we also can have TCA, tricyclic antidepressant. So imipramine is going to be one of the TCA, and this is going to be one of the SSRI. Fluoxetine is an SSRI. So the only one that is left in the given choices is going to be mirtazapine. Do you remember mirtazapine is one of the receptor modulators? What is mirtazapine? It's one of the serotonin receptor modulators. It acts on the serotonin and noradrenergic, mainly serotonin, noradrenergic, and serotonin agonist. So ये रिसेप्टर पे काम करते हैं. नॉरएड्रेनर्जिक एंड स्पेसिफिक सेरोटोनर्जिक रिसेप्टर एगोनिस्ट, रिसेप्टर मॉड्यूलेटर्स बोलते हैं इनको. ठीक है. दे आर द एटिपिकल और अदर एंटीडिप्रेसेंट की क्लास में इनको रखा गया. Atypical or other antidepressant, mirtazapine. So among the given one, they will be associated with the lesser sexual side effects. TDM पे क्वेश्चन बार बार आता है. A patient was prescribed a high dose of penicillin along with gentamicin for his symptom. Which of the following statement is true regarding this? So this question is a exact question that has been asked in the previous examinations. ठीक है. In some of the board examination it has been asked. ठीक है. So TDM is an important topic. Go ahead please. Which of the following statement is true regarding this? TDM must be done for penicillin. TDM must be done for gentamicin. TDM is therapeutic drug monitoring, done for both penicillin and gentamicin. TDM need not to be done. Go ahead. Therapeutic drug monitoring. It is usually done if there is a narrow therapeutic index. TDM is done if effect cannot be measured via other investigation, or if the drug is showing different absorption in different people, वहाँ पे भी it can be required. If ever we can measure the effect via other investigation, or if the drug is having wide therapeutic index, TDM is not required. Penicillin is the example of a drug that is having actually a wide therapeutic index as compared to same, that is aminoglycoside, which is gentamicin that we have. It is having narrow therapeutic index. It is known to cause ototoxicity. It is known to produce nephrotoxicity. So mostly with the aminoglycoside we need TDM. A very simple example I used to give you, that TDM is done in the drugs that I used to tell, that remember by the mnemonic Pyara Dalit. TDM is done in Pyara Dalit, phenytoin, digoxin. These are just the example of drug. Aminoglycoside, lithium, immunosuppressant like cyclosporin, tacrolimus, tricyclic antidepressants, and also with the theophylline. They are also having toxic effect. ठीक है. So Pyara Dalit, P Dalit. Just remember like this. ठीक है. So TDM is not done for both, remember, and of course with the gentamicin TDM may be required. ठीक है. Correct answer for this one is going to be option B. The most common drawback of this, I remember in 2015-16 they didn't give the image, they just give in the word that a patient is going to take inhaled steroid. Which of the following will be the following drawback will be seen? What will you advise to the patient? तो ऑप्शन में था कि advice for gargle. Every time the patient takes, the patient has to gargle. ठीक है. Now this time they did a little bit of modification in the question and they give an image, and now they are asking what is the most common drawback of this. Same question है, different language में पूछ लिया. ठीक है. So एक saying है that पुरानी शराब नए बॉटल में. ठीक है. Go ahead please. Most common drawback of this is portability, very easy to carry, that's not a drawback. Does not provide instant relief, I think it does. ठीक है, they always used to keep 1 to 2 puff is enough to produce immediate relief. Drug deposited in oropharynx must be administered in hospital settings. It is never mandatory to be administered in hospital setting. Definitely a patient can take, but it's not, or it must be administered in a hospital setting, no. Highly, you can easily carry it, and patient can use by themselves. We just need to educate them. But one of the problem that we get to see with this one is oropharynx में deposition हो जाता है. Therefore, it can even lead to oropharyngeal candidiasis, and that's why to avoid that, like let's say steroid अगर दे रहे हैं, so to avoid that, we advise them every time they are going to take, they need to gargle. And also other thing that they can do, that they can use spacer, because one drawback that we also see with this one, that whenever a person take, it needs a lot of expertise. So if there is an elderly or if there is a pediatric patient, they won't be able to coordinate their breathing along with the drug, synchronization नहीं हो पाता है. Then we use spacer for that condition. Spacer, this is going to be the mouthpiece which the person hold in the mouth, and this is going to be, here we will be putting the drug, and this is the pump that the person is going to just press, and the drug will come, the drug will be deposited here, and from here the person can simply breathe. So synchronization, breath synchronization is not required with the spacer, and the person can just continue to breathe normally, and the drug will be easily given to the patient. ठीक है. Okay, drug that reduces mortality in COVID patient. Very easy question. Which drug can reduce the mortality? Steroid, remdesivir, favipiravir, low molecular weight heparin. So multiple drug where got emergency drug approval. The only one that has shown to reduce the mortality, the one that act like magic, was steroid. None other drug has shown to reduce the mortality. ठीक है. Multiple drugs came, and they came on with lot of promise, but steroid की जैसा किसी ने काम नहीं किया. Then similar to this on the COVID, they also asked about interleukin 6 inhibitor. 2 times they have already asked. So we have sarilumab, 6 is sarilumab, and we also have tocilizumab. So tocilizumab is tocilizumab. I used to say tocilizumab. Okay. So that is also one of the drugs that is emergency use authorization in COVID patient, interleukin 6 inhibitor. Mechanism of action of anti-migraine drug causing angina-like symptom. Go ahead, please. Mechanism of action of a drug causing angina-like symptom. So release nitric oxide. First of all, nitric oxide will never be causing angina-like symptom. Inactivate calcium channel. That means they are talking about calcium channel blockers. Or 5-HT agonist, 5-HT antagonist. Go ahead, please. All the students, those who are live, please go ahead. Very good. So most of you are marking, but some of you are marking D. सबसे पहले एक सिंपल सा एक लॉजिक ले लीजिए. सेरोटोनिन में वी हैव मल्टीपल रिसेप्टर. 5-HT में वी हैव 4 रिसेप्टर, लाइक 5-HT1 1 के फिर हमारे पास 1A होता है, 1B/D होता है, 5-HT2, 5-HT3 एंड 5-HT4. सो एगोनिस्ट एंटागोनिस्ट के लिए सबसे पहले एक रूल समझ लीजिए, वेरी सिंपल रूल, एंड इट विल हेल्प यू इन द एग्जामिनेशन एज वेल. 1 and 4 जो होता है, 1 and 4, the total score will become 5. 1 and 4 का we always use agonist, like prucalopride, one of the drug that has been asked already. Prucalopride, that is going to increase the intestinal motility. They are the 5-HT4 agonist. So 1 and 4 का हमेशा हम agonist यूज करेंगे. 2 and 3 will again become 5. So rule of 5 याद रखना है. 2 and 3 का we will be using antagonist. So ये तो आपको याद रखना है पहले चीज. Now 5-HT agonist antagonist, whenever we are going to use migraine के लिए treatment के लिए, we will be using 5-HT1B by D agonist. That is going to be your just like sumatriptan, all the triptans. Now the problem with triptans that they are having some vasoconstricting effect on the heart as well. Okay? Triptans, they are having vasoconstricting effect on the heart, so they are contraindicated in known MI patients, MI or angina patients. Okay? Because they can cause further coronary vasoconstriction. Okay? Correct answer for this one is 5-HT1 B by D agonist, so 5-HT agonist. Currently we are having one more 5-HT1F agonist. This is one new drug, that is lasmiditan. Okay, lasmiditan. This is one of the 5-HT1F agonists. The good news is that it's also effective in migraine, but it doesn't cause coronary vasoconstriction. That is one good news that we have. So it can be used for the management, and again we will not be having coronary vasoconstriction. It is highly efficacious drug as well, lasmiditan. So in upcoming days, if it is going to be promising, definitely it will be it might replace triptans, who knows. Okay, lasmiditan. Okay, now ergots are also having the same kind of effect, 5-HT1B by D agonist. Remember that. Match the following. Match the dilution of adrenaline and its route of administration. So let us see this question. Adrenaline ka, again ANS, one of the very very important topic. 1:1000 intracardiac, 1:10,000 intramuscular. Go ahead, all of you, please. 1:100,000, 1:200,000. Let's see how many of you can do this. We have just 1 to 2 more questions left, and then we will be done. The dilution of adrenaline and its routes of administration. Usually, intramuscular routes जब भी हम देते हैं, we always give 1:1000, and this is the drug of choice also in anaphylactic shock. Anaphylactic shock में 1:1000, which I was talking also in one of the previous question. 1:10,000 if we are going to give the intracardiac or intraosseous. उसमें भी we can use 1:10,000. So again 1:100,000 for local vasoconstriction, like let's say epistaxis. Local anesthesia के साथ we will be giving 1:200,000. ठीक है, local anesthetic like with lignocaine we can give 1:200,000. So this is the correct one. I think some of you have given the answer already, Dr. Shantanu. So I have written here also BADC is the correct answer. Which of the following drug will not produce fixed dilated pupils? Just remember, fixed dilated pupil, very simple question. Cocaine is a sympathomimetic drug, definitely can cause fixed dilated pupil. Pilocarpine that we have, it is one of the M3 agonist. This M3 agonist will be causing your active myosis. It is going to cause active myosis, and that is why it can be used in the management of the glaucoma. It will never cause fixed dilated pupil, remember. Phenylephrine definitely can cause fixed dilated pupil. Likewise, amphetamine that is acting by the displacement reaction, sympathomimetic drug, can also cause fixed dilated pupil. So any sympathetic drug, it can cause mydriasis, like phenylephrine. Any parasympathetic drug, P for parasympathetic, P for positive action, I used to say, they will be causing myosis. Right? Pilocarpine is an M3 agonist, they will be causing myosis. Simple question of ANS. Which of the following drug can worsen myasthenia gravis? Another question. The drug that can worsen myasthenia gravis. Now we have multiple drugs that can worsen, especially like NM blockers, some antibiotics like aminoglycosides. You know, among the given choices, meropenem, one of the carbapenems, alpha blockers, lignocaine, penicillin. Among the given choices that we have, the one that can worsen myasthenia gravis would be not alpha blocker, doctor. It is lignocaine actually. Lignocaine, a local anesthetic drug that is going to act by sodium channel blocker. It will be worsening myasthenia gravis. So among the given one, antibiotics, example like aminoglycoside macrolides, beta blockers, botulinum toxin. Botulinum toxin is going to inhibit the acetylcholine release. Chloroquine, quinine, curare drug. They are the NM blockers or any of the NM blocker drugs, and lignocaine, a local anesthetic drug. It can also worsen the myasthenia gravis. ठीक है. So among the given choices, lignocaine, I would go ahead with the lignocaine. Okay, a patient with glaucoma, intraocular pressure 36 mmHg, presents to you with the KPs, keratic precipitates, and cells in the anterior chamber. So mainly KPs, Kopis nodule, Busaka nodules, cells in the anterior chamber. They are mainly talking about what? Acute anterior uveitis. Very simple, acute anterior uveitis. Which of the following is not indicated for this patient? So this is the last question for the day, and I hope that all of you can get this. Which of the following is not indicated? That means which can further cause this acute anterior uveitis? Glaucoma का patient है, intraocular pressure high है, presents with the KPs and cells in the anterior chamber. So this is going to be a secondary glaucoma, because uveitis can also cause glaucoma. Uveitis can also cause glaucoma, remember that. It's a secondary glaucoma actually. So which of the following drug is not indicated in this patient? Is carbonic anhydrase inhibitor, mannitol, timolol, or PG analog. PG analog that we have, drugs like your latanoprost, bimatoprost, tafluprost, travoprost. These are the prostaglandin analog. Okay, so most of you are marking D here. So first of all, I'll give you the correct answer. Since this is the last one, I'll give you the correct one. And a very simple way to remember all the side effects, because they are PGF2 alpha analog. So what are the important side effects that they are going to cause? They will be causing a side effect known as your pigmentation of iris. Pigmentation of iris, जिसको हम बोलते हैं क्या? Heterochromia iritis. Heterochromia iritis. Heterochromia iritis, very common term that is used in ophthalmology. Growth of eyelashes, जिसको बोलते हैं hypertrichosis. Growth of eyelashes. Foreign body sensation. Fat atrophy of the orbit. Fat atrophy of the orbit. Because of the fat atrophy of the orbit, what will happen? The eyeball will be sunken. There will be sunken eyeball, and there will be anophthalmos. Fat atrophy of the orbit that can lead to your anophthalmos. Anophthalmos and acute anterior uveitis. It can lead to development of the acute anterior uveitis. So very, very simple mnemonic that we have to remember all the drugs that we are having, all the side effects in PGF2 alpha analog. So we have pigmentation of the iris, heterochromia iritis, growth of eyelashes, hypertrichosis, foreign body sensation, fat atrophy, and alpha. So we have PGF2 alpha. PGF2 alpha उसका mnemonic ही हो जाएगा, ठीक है. So that is also one of the very simple trick to remember all the side effects. Fluid. That is a relatively rare side effect, but definitely you can remember that as well. But these are the important ones that you should remember. Pigmentation of iris, growth of eyelashes, foreign body sensation, and fat atrophy of the orbit leading to anophthalmos. Remember, it is going to cause anophthalmos, not exophthalmos. Acute anterior uveitis, right? So these are the important questions which I wanted to discuss with all of you guys. So glaucoma wale drugs और उनकी side effect. Some of the atypical questions like drug worsening myasthenia gravis. ANS question. So ANS, I always used to say that drugs affecting the eyes, drugs affecting the bladder, always a hot topic. ठीक है. Adrenaline के different concentration has been asked previously as well. Migraine, another hot topic. Migraine, pulmonary hypertension, and atropine, clonidine, they are always hot topic. COVID recent topic था, इसलिए इसका question भी है. Then we had this common drawback of this instrument. Therapeutic drug monitoring, another very important topic that we have discussed. Important side effect of SSRI, SNRI, or sexual related side effect. Like in upcoming examination, they can give you which of the following drug can cause impotency. So we have multiple drugs that is causing impotency. Like let's say a clonidine is known to cause impotency, or beta blockers are known to cause impotency, right? Then antibiotic-induced side effect type B ADR. Absence seizure, another very favorite topic for them. Different antidotes, very, very commonly asked. So hematologic antidotes and other antidotes I have also summarized here. We have also discussed osteoporosis, some off-label and FDA-approved use of Risperidone also we have discussed here. And another tricky question of Topiramate that we have discussed. फर्स्ट ऑर्डर जीरो ऑर्डर काइनेटिक्स में हमने थोड़ी बात करी, एंजाइम इंड्यूसर एंजाइम इनहिबिटर पे वी हैव डिस्कस्ड, प्रोग्राम डेथ सेल रिसेप्टर 1 एंटागनिस्ट, दे आर डिफरेंट यूजेस, है ना, right? And another question, inhaled nitric oxide and pulmonary artery hypertension. So these are the important questions that we have discussed. I hope you guys have enjoyed the session. I hope you have learned something new, and when you open your notes next time, you will be making sure that you are going through these topics very, very carefully. These are the important topics. Then on 24th, that is day after tomorrow, I will be live again at the same time to discuss with all of you guys some other important topics related to this INI-CET exam. So thank you very much to all of you for your presence and attendance, and I'll see you in upcoming classes. If there's anything that you want me to cover in these free sessions, you can just message me. I'll try to take it as soon as I see the message. As soon as I can plan my schedule, definitely I'll take that. Okay, so that will be all. Thank you, doctors. Have a good night to all of you. I'll see you. Bye bye.